Escherichia coli. Coli is a widely studied bacterium that has both beneficial and harmful roles in human health. This rod-shaped, gram-negative bacterium naturally inhabits the intestines of humans and animals, contributing to normal gut functions like aiding digestion and synthesizing vitamins. However, some strains of E. coli have a darker side, becoming notorious for causing serious diseases. Interesting facts about E. coli. One of the most fascinating aspects of E. coli is its incredible versatility. While some strains are essential for gut health, others can become deadly pathogens. For instance, E. coli is one of the most well-known dangerous strains. It was first identified as a cause of disease in 1982 during an outbreak linked to undercooked hamburgers, earning it the nickname hamburger disease. E. coli has an impressive ability to survive in various environments. It can live outside the body for hours to days, depending on the surface, making it a significant culprit in foodborne illnesses. The bacterium's resilience contributes to its prevalence in contaminated water and food, which is why it's frequently associated with outbreaks of food poisoning linked to unwashed produce, undercooked meat, and unpasteurized dairy products. The Shiga toxin-producing E. coli strains like release toxins that damage the lining of the intestines, leading to severe illness. In some cases, the toxins can enter the bloodstream, causing hemolytic uremic syndrome, which can result in kidney failure, particularly in young children and the elderly. Diseases caused by E. coli. The primary illness caused by harmful strains of E. coli is gastroenteritis, commonly referred to as food poisoning. Symptoms include severe stomach cramps, diarrhea, often bloody, nausea, and vomiting. In rare cases, E. coli infections can lead to hemolytic uremic syndrome, a potentially life-threatening condition characterized by the destruction of red blood cells and acute kidney failure. E. coli can also cause urinary tract infections, UTIs, particularly in women. Pathogenic E. coli strains can ascend from the gut to the urinary tract, leading to infections that cause painful urination, frequent urges to urinate, and lower abdominal pain. If left untreated, these infections can progress to the kidneys, causing pyelonephritis, a more serious condition. Prevention of E. coli infections. Preventing E. coli infections requires proper food handling and hygiene practices. Some key prevention strategies include thorough cooking of food. Make sure ground beef and other meats are cooked to at least 170 undeck to kill harmful bacteria. Wash produce. Fruits and vegetables, especially those eaten raw, should be washed thoroughly before consumption. Avoid cross-contamination. Use separate cutting boards and utensils for raw meat and other foods. Hand washing. Wash your hands with soap and water after using the restroom, handling raw meat, or touching animals, particularly in petting zoos or farms. Avoid unpasteurized products. Only consume pasteurized milk, cheese, and juices to minimize the risk of bacterial contamination. Water safety is also critical in preventing E. coli outbreaks, especially in areas where sanitation infrastructure is lacking. Boiling water before drinking in high-risk areas and avoiding swallowing water when swimming in lakes, rivers, or pools can also reduce the risk of infection. Treatment of E. coli infections. The treatment for E. coli infections primarily focuses on managing symptoms, as antibiotics are not always recommended, especially for strains like antibiotics can increase the risk of HUS by causing the bacteria to release more toxins. For mild infections, the primary treatment is hydration to replace lost fluids and electrolytes. Most cases resolve on their own within a week. Over-the-counter medications like loperamide, Imodium can be used to manage diarrhea, but should only be taken under medical supervision, as they can sometimes prolong the infection. In severe cases, particularly when HUS develops, hospitalization is often required. Treatment may include intravenous fluids, blood transfusions, and dialysis to support kidney function until the body recovers.